Welcome to today's episode of Health University, where today I have the pleasure of talking with Dr. Diane. Dr. Diane Mueller is your libido doctor. She's a naturopathic doctor and a doctor of acupuncture and oriental medicine. And her focus for the purposes of this conversation is to have a heightened awareness on what can happen to our desire, our libido, as we go through a fertility journey, whether it's trying to conceive naturally or going through advanced reproductive therapies. So thank you for joining us, Dr. Diane. And please, if I haven't added something that you would like to add, please let the listening audience know, a little bit more about you.
Thank you, Dr. Susan. It's so good to be here. And I think the first thing that I really love introducing these types of conversations with is a phrase that I use a lot, which is couples that play together, stay together.
I love that.
And it's clear in research that couples that take at least one time per week to connect intimately, that could be sexually or not, but at least one time a week to connect intimately, report a higher level of happiness and success in their partnership.
Mm-hmm.
So I think a lot of what we're talking about today is going to, and a lot of what I talk about in general can really be distilled, if we're going to distill it down simply, to this fundamental thing around how do we keep during stressful things, stressful times in life. We're talking about intimacy and libido and IVF and fertility today. So how do we really keep things strong during these times that are kind of stressful?
Mm-hmm.
And part of that really comes down to this, this oversimplified statement of couples that play together, stay together.
Well, it may sound simplified, but it actually demonstrates really succinctly that intentionality is the cornerstone for making it through the ebbs and flows of the natural ebbs and flows, as you say, whether you're trying to conceive naturally or going through an advanced reproductive therapy process, which can make it a little more clinical. The intentionality of we are a couple through this. We're in this together and we love each other and we lust each other. I love that phrase. I hope that you use that forever.
Yeah, I really do plan on it because you're right. It's like in thinking about these things around libido, around fertility, so much of what we're taught when it comes to making babies, when it comes to how do we go through IVF and all the medication and all the things that come with it, so much of it is medical, right? But we're not talking about a lot of the components of, well, how do we do this in a way where we're actually managing the stress of this in a way where something that can be so just exhausting to people on a personal level, but also on a relational level? How do we actually go through this in a way that brings us closer together during this challenge? And, another thing that I like to say a lot is like, we're really working to break through the taboo because there's like so much emphasis on this one area, I feel like IVF and fertility, without focusing on, well, how do we focus also on, we're working on making baby, we're investing a lot of time, effort, money, energy, all these things, but how can we do this in a way that at the end, hopefully we have baby, less better relationship,
Exactly.
right?
Yes, that is so beautiful. So, and when I think about, the IVF process, that hormonal hyperstimulation, which is necessary to grow more follicles, to extract more eggs, to get more embryos, that's having hormonal changes in the person's body who is undergoing the injections. And here again, in life, we go through hormonal changes. I know that you like to geek out, and I like to geek out as well. How would you describe to the listening audience why and what to expect that these hormonal fluctuations are actually, it's not abnormal for them to feel an ebb and a flow in their libido?
Yeah,
Did that question make
absolutely.
sense?
It does.
Okay, good,
It
good.
does. I mean, the first thing I think we have to say in the conversation around hormones and the hormones that are prescribed and the ebbs and flows of libido, I think the first thing we really have to say is that it is individualized. Like I've worked with clients that whether we're talking fertility or whether we're just talking about normalizing hormone balance just for health, we're really looking at changing, if we change estrogen and progesterone and sometimes even testosterone levels, all of a sudden things might get super revved up and turned on and they feel excited. And then I've worked with other people that changing these hormones and manipulating them, they go through a period where it's like it almost feels like they're going through puberty again, or, early onset menopause or whatever it is, like where there's these time periods where their libido is just in the toilet. So the point of that, I would say, is that what I see when we're changing these hormonal levels, that there is a huge individualized component of things. Like, yes, typically in health, right, it's very common that in a healthful state, that when we have that estrogen surge around ovulation, to talk medically, right, that when we have that estrogen surge, which also comes with that testosterone increase as well, right? That we feel a sense of wanting it more, right? That we
Absolutely.
really
Yeah, I
want
mean,
to want
it's
it.
the horny hormone for sure.
Right.
Yeah. And you make a very good point. I'm sorry, I don't want to interrupt, but I too have seen it both in the, in the patient treatment room and in the client conversation. There are women for whom, when they're getting this extra estrogen, they feel great. There are others, when they're getting this extra estrogen, being produced in their own physiology, in their own body, they feel like crap. They feel bloated. They feel awful. So you make an excellent point in that there isn't a one size fits all. It is individualized, and really either of your responses or reactions to the hormone stimulation is your body's reaction. So have a little bit of compassion and support for yourself.
Yeah, and I think the bigger thing is to go into any of these types of scenarios with an anticipation and a plan that, yes, likely something is going to change, because we are manipulating hormones. And so whether that is an increase in libido and desire for your partner, or whether it's a decrease, going into this with kind of the awareness of like, something's going to change, having a plan on both sides of things of how you're going to manage that. Because also is something like we have to be careful about. It seems like when we're creating babies, right, like an increase in libido would be a really good thing. But what happens if we increase it so much and then we start coming on to our partner, and then our partner's not there at the same level as us? So there can be that rejection that comes with it. So I think the more we can go into this just with kind of that plan of, yes, we will likely, because we are manipulating with hormones, we will likely see some of those changes. And then how are we going to communicate about that? One of the things I do a lot in my work is something called intimacy escapades. And they're basically like scheduled sex or intimacy dates. But I call them intimacy escapades because some of them is really about teaching people to schedule like these emotional intimacy dates, which are largely just these check-ins of like, hey, what's going on? Are you hanging on to anything I said this week that didn't sit right? Are you feeling, bad or good about X, Y, and Z that happened last week? And there's just these moments to actually check in on the relationship and on what's going on, when there's these little kind of like, maybe like micro cuts of hurt that we get, that we just kind of blow off of like, oh, that's not that big of a deal. And it's not.
But
But if we can,
yeah.
and then a small leak becomes a big hole. And because of the stress, I think with something like fertility and IVF that so many couples go through, that's why I think it's important to have these types of plans, especially during this time, to say, check in and say, hey, maybe I lashed out as I was getting on a new hormone and my emotions were out of balance. And while that is natural and normal, it can be impactful, right? And so how do we actually create that space on a regular basis for saying, what is going on? How are you feeling about this? Did we hurt each other this week? Yeah. How is the sex drive going? Are you satisfied with where we're at? Can we manipulate any of that? Because things are going to change. And without a plan to talk about it and making it normal, that's where I think we run into problems.
Yeah. And ironically, for most people, I find we're not taught to communicate that way. We're taught to maybe look for cues or signals, but that's all through our own filters. And our filters could be a little bit squirmy, little as when we're not feeling quite centered. So I love this idea of the intimacy escapade, where there's an intentionality, again, that word, around coming together for the purpose, not of rehashing a hurt, but of healing a hurt, or amplifying something that went really well.
Yeah, in some ways it's like you could say spin-off of just the understanding of like books like Men Are From Mars and Women Are From Venus and those kind of things, right? It's like there's these fundamental principles that we've known for so long, that the female brain and the way estrogen and progesterone impacts the female brain, and of course we have testosterone too, but the level of relationship, right, of course, is higher with estrogen for women versus men.
Mhm.
And the impact on the brain is so, so, so different. So I really feel like what we're doing in some of these situations where we're coming together is exactly that. It's not to rehash, it's to say like, hey, when you said this the other day, the way I understood it was X, Y, Z. Is that actually what you meant? And a lot of times when we say that, it's not about, like you said, rehashing. I love that you use that word, because it's not about rehashing. It's about just like, oh, I understood it to mean this, and I maybe developed a hurt or a story or a belief about our relationship because of that. And that might not have been what you meant at all, and oftentimes it wasn't. So we're kind of just cleaning up that trash because, you know, of the men are from Mars, women are from Venus concepts of so many times we say things, and then, you know, the opposite partner, especially in a hetero relationship, the opposite partner oftentimes it's so easy to just take that and interpret it as something very different, just purely because of how differently our brains operate.
Yeah. Yeah. Although I would go so far as to suggest that it really isn't just for a hetero relationship. I've seen so many same-sex couples go through the exact same thing with miscommunication. And you and I both come from a background of Chinese medicine. So I would also say it might be beneficial to kind of think about where, if you've got a question or a hurt, think about where it's landing for you. What emotion is coming up for you? Are you fearful because of what just happened? Are you angry? Are you kind of overthinking that thing? Are you feeling grief stricken? Are you feeling like you want to run away? All of these are little ways in which we can help. We, with this 5-element model of understanding, and help you understand where things are going a little sideways, so that you realize, oh, it's just my constitution that went a little off. And if we're dehydrated, we need a glass of water. If we're a little off in our emotional balance, and we can just reinforce that as well.
Yeah, absolutely. And just to
Yeah.
clarify, I totally agree as far as like same-sex couples. The only thing I was kind of getting at with that was more around the differences of the way the blood flows to the brain with
I
different
see.
hormones, right?
Gotcha.
But yes,
Yeah.
of course, misunderstanding can happen with like any type of relationship, because
Yeah.
that's just the nature of humans. And, you know, I even see that in my girlfriends around
Yeah.
like, oh, we say things to each other like, that's not what I meant, you know what I mean?
Right.
And so I, even with my, you know, my friends, I practice that sort of, you know, same type of communication of, oh, you said that last night, that sat really weird. Is that what you meant? And
Yeah.
it's so lovely because it brings us closer together instead of
Absolutely.
creating that distance.
Absolutely. In your program, in the Libido Lounge, do you have, templates or processes that the listening audience could say, oh, I'm curious, I'm piqued as to this part of the conversation. I want to learn more. Where can I find more?
Yeah, I mean, the biggest thing that I really find when we're talking about libido across the board is that it's broken down to say 3 main tiers or categories as far as the reasons behind low libido. So that's from a template standpoint, from a talking standpoint, that's one of the biggest things. I do have my quiz, libidoquiz.com, where people can go to, and libido quiz is focused on one of these core 3 pillars. So the 3 pillars are personal, interpersonal, and physical. So physical is a lot of the stuff when we're having these IVF conversations. It's a lot of what gets focused on. We're looking at hormonal balance. We're looking at egg quality. We're looking at, sperm quality, all these types of things. And we're even considering other things, for example, like cardiovascular flow.
Right.
Right. So like those are
Metabolic,
all
just
yeah,
all of these
exactly.
lab related things.
Correct.
And we are not, our labs are data points, they are not us. So yeah.
Yes, exactly, exactly. And so libido quiz is a very easy thing, that place that people can go and just take a quiz and get a sense of like, oh, is it more likely X, Y, Z, as far as from a physical standpoint, where they can get insight as to, hey, if you have to prioritize lab tests, you mentioned lab tests, like, okay, it's kind of a guide to say, out of all these different physical root causes, this one is likely the most top root cause. So oftentimes it can serve as a guide to, hey, maybe of all these different tests you want to take, maybe here's where you should start. So that's really useful.
Beautiful.
And then and then I'm sorry, were you going to say something else?
I was just going to recite. It is thelibidoquiz.com. Just
just libido.
libidoquiz.com. And all of this will
Correct.
be in the show notes, but there are people who might be out for a walk going, what was that? What was that? So
Yes.
libidoquiz.com, and then go look for the show notes.
Yes, yes,
You're about to
exactly.
expound upon it. Please go ahead.
Yes, and then, from there, and this also, I think, feeds into one of the things we were talking a little bit offline around, like, how do we keep our sexual drive
Yes.
intact when the IVF process can be so medical, right? And so the other two pillars can really feed into that. And the one is personal.
Mhm.
So, and what I mean oftentimes by personal, and where there's a lot of exploration to do, is so many times when we come across libido, we come across our own desire to wanting it, we're not focused at all on, we're not taught, I guess is a better way to say it, what our own needs, wants, preferences, desires
Pleasures.
are, right? And we're not taught, like, one, how to explore those things, two, how to communicate those things. And unfortunately, so many people get their, sex and intimacy information off of some movie they saw long ago, or some article they read in Cosmopolitan, or, whatever type of magazine. And it's so much more individualized than that. So a lot of the personal side of things is really helping people to understand that sometimes low libido is just not having intimacy, whether sex or not, just not having those intimate moments in a way that's actually right for the uniqueness of the individuality. And we're talking about 5 elements and, all the things we know from Chinese medicine. One of the great things that these types of modalities like Chinese medicine do is they really look for the individual imbalances, right, that you're talking about. And the same thing is with sexuality. It's like, it's so, just like our health, our physical body, everything we do in our medical practice can be so individualized. The way we experience sexuality is as well. And so that's a huge thing. It's really helping people, when we're actually keeping things alive with going through something like IVF. It's about beginning to understand what are our needs and preferences and desires. And maybe throughout all these hormonal changes, maybe they're changing day by day, which can make us feel sometimes crazy. But at the same time, it actually provides a really cool opportunity to begin to develop, like, okay, well, everything's changing every day anyways, like how I feel and what I want and what my desires are. So what a great opportunity to put in those, those practices of checking in with our partner during those times.
Absolutely. And as I'm listening to you, I'm also thinking, checking in with ourselves first, so that when we check in with our partner, we actually have, I'm going to call it a deliverable. We have our part of the conversation, because I think that is where I've seen, and I actually can almost get a little verklempt, in my practice, it's mostly women who are going through IVF, and they suffer for 2 reasons. One, they feel as though they need to protect their partner from the emotional lability they're going through. And then they feel that their partner isn't able to support them. And it's kind of a double-edged sword, if you will, right? Because as both are true, the only way we can begin to penetrate that change and pivot into, like, oh, let's look at this together. And as a couple, is to first look at ourselves. How am I today? What, what do I need? What do I want? And then we can take someone and to our partner. Does that resonate with how you have experienced the work with couples as well?
Oh,
Individuals
you're
and couples?
actually setting me up perfectly for the pillar
Okay,
3. So
here you go.
yeah, that's exactly why I talk about personal prior to talking about what I call the pillar 3, which is the interpersonal, because of exactly that. The interpersonal is really around, okay, well, how do we learn to communicate to our partner our needs, wants, preferences, desires? How do we learn to actually ask and receive our partner telling us theirs?
Yes.
Right. And so some of those details around communication is really what we get into. But like you're hitting the nail on the head with the way I approach my work, which is how we can't begin to get to that interpersonal if we haven't explored the personal and really have, an understanding. And I tell people it's like very detailed understanding you want. It's like, down to like, oh, I want my neck just up here, but not 2 inches below. This part feels good, that part doesn't. And the more detail we can actually give, the better we're setting up our partner for success. Because innately, anybody in a romantic relationship probably has a fundamental desire to provide joy and love and pleasure for their partner,
Right.
right? So we
Right.
all tend to want this. I think this is a huge human state that we have when we're in a healthy, loving relationship, is that desire to give to our partner, that desire to receive. And so much of this comes down to setting that partner up for success, because since we do as humans have a tendency to want to give, the more we can understand what to give in a way that our partner is going to receive it better. Kind of like the love language book. And I have my own
Yes.
versions of that I call the sex languages. And it's very similar. It's like learning our innate style
Yeah.
in order to be able to communicate that. And that's why personal has to come before
Yeah.
interpersonal,
Yeah,
right?
it's so funny. When I was hearing you say interpersonal, I was like, is she saying intrapersonal before interpersonal? And the answer is
Yeah.
yes. And you're absolutely right. I mean, I just speak for myself. There are days, where a partner's hand at my lower back feels so great. There are other days where I just want to walk away from it because I'm not ready for it. So, just being able to check in the morning or different times of the day or before you come together to just say, where am I right now? What do I need? How can I best communicate that lovingly? Because it's a lot harder to resolve, walking away from someone making an intimate gesture than it is to start by saying, you know what, today, for whatever reason, that thing that I usually love, it's just not working for me. And then it gets this person off the hook for trying to do the thing that always worked for you, but no longer. Yeah.
Yeah, exactly. And I talk a lot about, like, one of the ways I tend to talk about that and helping people and approaching it is what I call like the where, the when, the how, and the what of communication. So it's especially in the beginning, like once I have found that couples get to a point where their communication is really dialed, where they know it's safe and like we can say, hey, I would prefer this versus that, and you're so practiced at it, the where, the when, the what, the how become less, I would say, important because there's such a net of safety there.
Yeah.
But in the beginning, when we're newly practiced at this or not practiced at all these details, like for example, from like a where and when perspective, I tend to find that, like, let's say that you just got done with this passionate moment, but there was this thing your partner did, and you just were like, oh, everything was good, but this one thing, right? And, you're in that moment of like love and tenderness. And oftentimes, if we say something right then, it can almost to our partners come across as like negating everything that was good.
Right.
So, really being intentional. And if somebody winds up being hurt in that conversation, when we're, say, in the bedroom, then there can be that memory, that almost like trauma association of like, last time I tried this, I got hurt. And like, and that can lead to performance anxiety, that can lead to all sorts of things. So, while I find that like really practiced couples, for example, can, after, having an intimate moment, can actually take a step back and, be in bed and cuddling and be like, hey, this was so beautiful. And that one thing, I just wasn't into that. Or, even in the middle of sex, honey, maybe that's like this, I'm not into it. But I do find in the beginning, we have to be very careful until there's that level of foundational trust.
Yeah.
Right?
Yeah. Because when you're in that level of trust, you don't feel or hear that request as a criticism. Yeah.
Correct. Yeah, exactly. That's so easy for the ego to be damaged with this stuff. And, for all of us.
Yeah, absolutely. So this may be an oddball question, but in my practice, where many women are going through IVF, the conversation is that the male partner, because most of these are heterosexual couples, kind of has left the building. That's her experience, is that he's left the building. I observe that he doesn't really, he's not invited with the special lock and key to get into the building during this process. And so how can he be invited? Can he even give injections or maybe apply heat or cold before injections if somebody else injecting you isn't the way to go about it? So toward that end, if you were to imagine a couple going through a process like this, what advice or suggestions might you give to the other partner, be it male or same-sex partner, who's trying to support the person going through the actual injections and hormonal stimulation so that they can feel a part of the process. Because once again, it really seems to me like at the end of the day, we're looking at this like we're in this together. So what might you say to that?
Yeah, I mean, I think there's so many layers and levels with this. So I would say very intro, and I'm gonna predispose or pre-frame, I guess, that's what I'm gonna say, because it was very intro. We can get much more deep than this. So essentially, very intro level is just like with fertility tracking, right? Where sometimes it's really helpful if we're in a hetero couple or not, it doesn't matter, but to give the whatever partner is worried about getting pregnant, I guess is the way I should say it.
Mm-hmm.
Whatever partner is not worried about getting pregnant, that other partner also has the responsibility of tracking and being like, honey, this is the day. And if we're trying to get pregnant, this is the day we're fertile. If we're not trying to get pregnant, this is the day we're, fertile as well. And just having that awareness, right?
Yeah.
So I think there's a level of that as well around, okay, making those types of things around tracking, around, okay, well, what sorts of things is it, if it's an injection day, what sorts of things are going to help the person receiving the injections? What sorts of things are going to help them feel calmer, more held, like they can actually, maybe if they're having a hard time, they can take some time off, and what sorts of things are going to be supportive.
Yeah.
And maybe the role of the other partner is setting that up. And maybe the role is like, hey, here's how I'm making these injections successful. And so the plan, they come together on injection day. Hey, I'm going to go to the doctor and do this. Hey, you're going to do this. And we're both actually having our goals together to make it successful.
That's brilliant.
So I think that's a really useful way of looking at it. Yeah. What are you going to say?
Yeah, I think that's brilliant. And once again, it really, I mean, it always comes down to communication and, and trusting that the other is your partner is wanting to do right by you. And when, as being humans, we will mess up sometimes. And so, being able to gently name that this isn't, landing the way that feels like it best supports us for both partners, because here again, while the person, again, staying with the IVF scenario, going through the injections is truly having the more labile experience. Things are changing for her. I'm going to use the term pronoun her, every day, every minute of every day. But then so is the partner also going through something. And so once again, I think realizing that we're in partnership, whether it's trying to conceive naturally and it's ovulation time. And so therefore our intercourse has a different intentionality than when we're just doing it for fun. Similarly, when we're, having our injections so that retrieval is going to come, we're doing it together so that when retrieval day comes, we're still a couple and then we can go back to our, not go back to, we can continue our intimacy. We can go back to our intercourse, but we continue our intimacy. Yeah.
Yeah, and I think the other thing to add there that you're just triggering me to say here right at the end, which is intimacy really is more than just sex, right? And, and I know you know that, and I know some of our audience knows that, but I think so often because of how we think and how intimacy is used in society, oftentimes, and even the word sex is used in society, we're often thinking about penetration, right? And I think that's another thing. It's like, when we think about how we manage stress, when we think about the impact of stress on fertility, and one of the best hormones to manage that is oxytocin, right? And so that intimacy hormone, like, yeah, it's an orgasm hormone, but it's also cuddling, it's intimacy, it's closeness. And so I think that's another thing, either like, ahead of time as a preparation, or if you're listening to this and you're already in the middle of it, like never too late, of course.
Exactly.
To really start setting aside like those intimacy dates. And what does that intimacy date look like? Because is it as simple as like, I'm going to use like a soft tickle on your back and down your thighs and just then hold you after, right? Like, what does your pleasure body? And it's a question, like, the question I use all the time in my practice and my personal life is the question of, what are my pleasure goals for this month? Or what are my pleasure goals for this quarter? And I think in relationship to fertility, in relationship to that closeness and that intimacy and support in this conversation, some of that is like coming down to, okay, I'm going to feel really bad some days. I'm going to be through some of these hard days. So rather than just focusing on that, of course, we have to focus on how we're going to manage that, obviously, but also what am I going to do to make sure that I have pleasure time?
Yeah.
And what does that look like with my partner in my
Right.
schedule? Even if that's as simple as like, we're going to go both get a foot massage and sit together and just hold hands and look in each other's eyes. You know, there's so many different ways this can look, but something that is like continuing to help bring us together in that way too, because that oxytocin's that bonding hormone.
Right.
And I think when we're talking about how do we stay connected during this time as, you know, as couples, that's a huge component. It's how are we bringing that hormone that is going to bond us? How are we making space for our bodies to actually create that hormone?
Absolutely. Yes. And thank you for bringing it back to pleasure, because, you know, we're trained to think of pleasure as post-orgasm, like, oh, that was pleasure. And pleasure is, you know, a beautiful sunrise or sunset, or a refreshing glass of water, or, you know, a hug or a kiss, or, you know, anything, a laugh together. So, oh, Diane, this has been so wonderful. I feel as though we could probably talk for another, I don't know, few hours or weeks or on this.
I have no doubt about that, Susan.
And I'm sure the audience got so much out of it. So I really appreciate you taking the time. Listeners, everything will be in the show notes, including references to how to get to Dr. Diane's site so that you can delve further if you'd like. And until then, I would just say thank you, thank you, thank you. Have a wonderful day, and we'll see you at the next time at Health University. Thank you, Dr. Diane.
Thank you. Bye, everybody.